guys, now I am going to explain how to wear the sterile gloves before doing any aseptic procedure. So before that, I will explain hand washing technique and how to open the gloves, how to wear the gloves. Okay. So in sterile gloves, we have the different sizes. It starts with 6 number, 6.5, 7, 7.5, 8 and 8.5. Then we have to wear the sterile gloves before doing any aseptic procedure in the bedside or any treatment room, procedure room, cath lab room or operation theaters. Now I am going to explain how they are following in the operation theater. Okay. Once the procedure is planned, so the scrub nurse and doctors, they will do the hand washing. The first steps, they will do the hand wash. After hand wash, they are entering into the operation theater. Then they are wearing the surgical gown. Then they will wear the sterile gloves. Okay. So we have to know the hand washing technique. According to the WHO, we have 3 types of the hand wash. One is hand rub, second one is medical hand wash, and third one is surgical hand wash. For the hand rub, we are using sanitizer gel. Okay. We are using any sanitizer or alcohol or anything we are using. How much time we are using? 20 to 30 seconds we are using according to the WHO guidelines. For the medical hand wash, how much time? So that is 40 to 60 seconds. Okay. For the hand rub, 20 to 30 seconds. For medical hand wash, 40 to 60 seconds. And surgical hand washing, how much time we have to do? According to the WHO, 2 to 5 minutes. So we have to know how much time we have to do the hand washing and which type we are going to select according to the procedure. Okay. So now I will show how to do the hand washing. Before doing the hand washing, we have to remove the watch. We have to remove the ring. That is must. Okay. So you have to wet the hand, take the solution, maybe sanitizer or any aseptic solution. Okay. Palm to palm. That is the first step. Palm to palm. Right hand over the left dorsum. Left hand over the right dorsum. Second step. Third, interlacing. Fourth, interlocking. Both sides. Then thumb rotation. Fifth one, thumb rotation. And sixth one, fingertip cleaning. Okay, both sides. Again, palm to palm. Right hand over the left dorsum. Left hand over the right dorsum. Interlacing. Interlocking. Thumb rotation. And fingertip cleaning. So for the surgical hand washing, we have to clean fingertip to elbow. Okay. We have to put our finger under the tap water. Then you have to clean like this. Fingertip to elbow. For the medical hand washing, no need this step. Okay. So I am only explaining, focusing on the operation theater, how they are doing. I hope now you can understand how to do the hand washing. Next, I will show how to open the sterile gloves. See, here you have the opening. So the circulatory nurse, she will open the sterile gloves. Okay, like this, we have to open. Then she will put on the sterile table, Meyer trolley or square trolley. Then we have to open like this, scrub nurse. Open the cover, inside cover. Don't touch the glove. If you touch, that is the unsterile. So be careful when you are opening the gloves. Now, according to the scrub nurse or surgeon convenient, they can select right side or left side. After opening the cover, take the gloves, put your finger inside. Okay. Don't do anything in this area. If you are doing it, that is the unsterile. Just you have to put the finger inside. That's enough. So left hand finish. Now I am going for the right side. So when you're going for the right side, don't touch this area. You have to put your finger inside here. Okay. Then put your finger. So you have to wear like this. So now we are not complete this one. After putting another hand only, you have to take this corner. Don't touch anywhere. Take the corner and adjust as you like. Okay. This is the type how to wear sterile gloves. Okay. I hope you understand how to wear the gloves.